I'm Tom Sloan, and I'm going to talk about insurance. Now, the world of insurance, if I were to talk about everything, it would take me 48 hours straight, and it's this wide. I'm going to narrow it down to a narrow focus of supplemental health insurance and how it can help a business with if they decide to offer an insurance plan. Going back, we have old Farmer Brown. He was having a bad day because he got kicked by his mule. So he had to go to the doctor. The doctor patched him up and sent him on his way, but before he said, what do I owe you? And he goes, the usual fare. Doctors back then said, give me a chicken and we'll call it even. Well, that was then. This is today. It's not normally done that way. Instead, instead of country doctors, we have fantastic hospitals that can do miracles with the human body normally. Fantastic doctors and nurses, but it comes at a price. How do we pay for this? Health insurance. Health insurance is a major thing when it comes to employees. Employees or people in the workforce, current or future workers, are looking for that. That's one of their topics when they say, what does this job offer? When they're thinking like, okay, I'm out looking for work, here's two companies. I have company A and company B. Company A pays more money, but has no benefits. Company B pays a little less, but has benefits. And right now, it's about 60% of the people would rather be at company B than company A. And that number is getting greater all the time because it's just becoming a big issue. Just the other day in the news, Ford Motor Company said that their health insurance is now going to top $1 billion. That's a huge amount of money, and they have a lot lower workforce than they ever had too. And I'm going to show one way in particular how to reduce the cost of health insurance for a small company. Now, what do I hear so often from people when I talk to particularly a decision maker? They say, I never get sick. But what they're really saying is, I never get sick yet. It's only a matter of time before they do suffer an illness or an injury. And then they got to go to the doctor, and then that's too late. You want to have your insurance first, not after. What's the number one cause for bankruptcies in the United States? Medical bills. People lose money on the stock market and bad investments and overspending, but medical bills is the biggest reason for that. This example shows $153,000. That's pretty high. Most medical bills aren't that high, but they can reach there. And again, in the news the other day, a lot of things happen in the news. A little boy in Oregon got cut on his head. He got tetanus, and he didn't have a tetanus shot. And with the hospital, and to make a long story short, the bill was close to $1 million. And that's like an insane amount of money. I don't know what the outcome of that is going to be. Obviously, unless his dad is Bill Gates, it's not going to happen. If you get sick and cannot work and your income stops coming in, what doesn't stop? Yeah, the bills. They keep coming in. So you want to protect yourself when that situation might happen. Because the creditors aren't going to say, oh gee, you hurt your foot, you can't stand to do your work. Well, we'll let you slide. That's not likely. Okay, the guy says, I got health insurance, my deductible is $1,000. No problem. Well, there's a lot of costs there besides your deductible. You have the deductible, you have co-pays, and you also have out-of-pocket maximum. The out-of-pocket maximum with the Affordable Health Care Act for the individual is $7,900, and for the family, $15,800. That's money that you're going to pay if you have a major health crisis. But there are other expenses that you may not be aware of and the average person doesn't think about, and that would be things like helicopter, air ambulance, medevac, however you want to call it. You always see that like in the news, something happened and they had to airlift somebody. They're not cheap, and they're not necessarily covered either. The average flight is $12,000 to $25,000, and I've seen examples where they're up towards $60,000. We have a friend from Illinois who had pancreatic cancer and had to go to the Cleveland Clinic in Ohio. they drove to Ohio, and their hospital plan gave them 5 days in the hospital, and then they said, you gotta leave, or you gotta stay in a hotel, because the hospital said, the doctor said, we need you for at least 7 days, you gotta stay longer, even though they couldn't stay in the hospital. They said, okay, so they stayed in the hotel. On the 7th day, she started bleeding severely, had to be airlifted, 5 minutes to the hospital, and that bill was $17,000. And that's real world examples. Another thing that people don't consider is physical therapy. Last July, it was in the news, there was a girl that was smashed up on the turnpike because she got hit by a truck, and they took the rescuers 4 hours to pull her out of the wreckage. She's paralyzed from here down. There's gradual improvement though, so everybody's still optimistic. The health insurance plan allows for 30 visits for physical therapy. But when that runs out, her and the family have to decide, do we want to pay another $750 per week for the same physical therapy? Or do we buy the equipment and keep it at home? It's thousands of dollars. Or do we just kind of limit her physical therapy? Those are hard questions that you have to answer that don't have good answers. So answer this. Do you buy health insurance to pay for a couple of doctor visits a year, or do you buy it to reduce your out-of-pocket losses should you have major illness or injury? Most people with a high deductible plan, they go here, but this is the reality of what you need. And so that's where it leads up to supplemental insurance. That's what I do. I'm with Aflac, and supplemental insurance is just that. There are numerous plans that you can choose from, including short-term disability that will pay the hospital bills if you're out of work and can't work. When those regular bills come in, you can at least get up to about 80% of your net pay with a disability plan. It pays money directly to you when you suffer from a medical event. So that's money in your pocket, and then that's up to you to do what you want to do with it, such as you can pay your deductibles and copays, because with these plans, there is no copay or deductible. It's not like, okay, we're gonna give you money, but first we gotta take out the copay that is ours. No, there isn't any, it's all your money. There's no referrals or networks. You can go to any doctor or hospital in the United States. It's not like a network that says, oh, I can only go to Penn, but I can't go to this one. That isn't a problem. Guaranteed renewable. It's guaranteed that you'll never be canceled. The only way you get canceled is if you cancel it or you don't pay your bill, when the premium is due. There's no physicals. They will pay you money to go to the doctor when you just go for a regular checkup. You say, I feel healthy, but I got to get my annual physical. So fine, they'll still pay you back like $40 or $60 depending on which plan you have. And that encourages people to stay healthy because they want to go to the doctor. With plans like this, when you are injured, a lot of times people say, ouch, I fell, I hurt my wrist. I'm going to tough it out. I'm going to shake it off, and hopefully in a few days it'll feel better. That's usually what we all do. But when you have an injury plan that for an accident you hurt your wrist, say, I'm going to the doctor right away because he can check it out and make sure I didn't do any real damage, and you will get money for that. So it keeps you in better physical shape because you are going to take care of yourself by not ignoring it. There's no coordination of benefits, so it doesn't matter what you have for your other health insurance, whether you got Blue Cross or Aetna, it doesn't matter, or nothing at all. This is a standalone plans. They are portable if you ever change jobs. So you have your Aflac plan with this company, Company A, and you decide, I'm going to quit and go to Company B. Well, you can take that plan with you. And there is no price increase, the rates are fixed. And so once you have it, I know people who've had their Aflac plans for 20 plus years. They're old plans, the particular plan doesn't even exist anymore, but it's still honored. and they have it and they still use it whenever they have whatever problem they do have. And they're still paying 20-year-old rates, so that's even great for them. There are pre-tax advantages that can save money for both the employer and the employee, such as when it's taken out pre-tax, the premiums, that money is taken off of your pay. So you're only paying tax on what your pay is minus whatever that premium is. Now, how much does this cost? Well, these plans are pretty cheap. For what you pay for a Big Mac meal per week is roughly what one of these plans would cost you. So it's very affordable. You have two kind of plans, low deductible and a high deductible plan with supplemental insurance. A low deductible plan is going to cost you more than that plan, but the insurance company is going to pay more than that plan. You're going to pay this much. But with this one over here, this is what the supplemental insurance will pay. That will pay not necessarily all of it, it'll pay some of it. It could pay more than that. This bracket could be bigger than this bracket. It helps fill that gap, but it's going to cost you overall a whole lot less. We have a daycare center that put in, they changed it from that to that, and they saved a couple $1,000s per month per employee. So that's like a huge savings for them. So a new business, a group can be as little as 2 people for regular insurance and 3 people for Aflac insurance for supplemental. 3 people can count as 1099 and part-timers. It's very liberal with that. Although with the 2 people for the regular health insurance, you have to be aware that it used to be, but they changed the laws, you can't have a husband and wife. You have to have a disinterested party. Ultimately, supplemental insurance is an ideal way to have health insurance plan when regular plans are not affordable. And what they have is they save money and peace of mind, or knowing that you're going to be safe and pretty much well protected. That covers that narrow band of insurance. And any questions, now or later?
You answered mine.
Okay.
About the wife.
Thank you. So that would be me, Tom Sloan. Thank you.